Dana,
Present.
Daniel,
Here.
Drew Simpson,
Present.
Elizabeth Padilla,
Present.
Emily Bertu,
I'm here.
Evelyn Salinas, Graves. If you're here, can you please let me know how to pronounce your last name? She is here. Gregory,
Here.
Greta Coe,
Here.
Hannah,
Here.
John McIlveen, Judith, Juliana,
Here.
June Bernard,
Here.
Kathy Cervantes,
Here.
Kylie Cordy,
Here.
Kirsten Brown,
She will not be here today, that I did find out.
Liz Burnley,
Here.
Luann, Mark Jansen,
I think I saw Marcus running late.
okay, Maya Wolf,
Here.
Megan Murphy. I think she was actually
Here.
Nicole Corbin,
I'm here.
Nicole Egler,
Here.
Rachel Lawrence, Sam Byers.
I'm here, sorry.
Oh, hi, Rachel.
Sam is here, and I also saw in the chat that Morgan Godwin is here, but the mic isn't working, so for
Okay,
some folks, so
thank
Well,
you.
I don't know. Is my mic?
there's Morgan.
Hi. Okay.
I'll mark you here, Morgan. And Sam, you're here. Sarah Adelhart,
Here.
Sarah Hubner or Hubner, Sean McMahon,
I'm here.
Stanley Minetti,
I'm here.
Tammy Madalena,
I'm here.
Tatiana, and Tim is absent, and we have quorum at 27.
Terrific. Thank you so much, Carly. I appreciate it. I appreciate
Absolutely.
everyone. Before we get started, I just wanted to put out there that we're going to put forward a rather bold goal for today, and that is to get through. Oh, Dharma's here too. That's right, Carly. I don't know if you called Dharma, but I don't think
Okay,
yeah,
thank you.
yep. Thanks, Dharma. So a bold goal of getting through, we have 6 counties ready for us to review today. And I'm hoping that we're able to get through most, if not all of them. And I know that we got some great feedback over the last meeting, just around understanding the role, understanding the responsibilities that you all have in the review process, and then the next steps. So just wanted to remind everyone that as a review panel, our work is really to put forward the best recommendation to the Oversight and Accountability Council. So we're looking at the applications that received 2 yeses from reviewers, and then just starting to where we need to begin to review some of the funding and be able to ask some questions in order to put forward you know, what we feel would be a burn or a package that, as Abby would say if she was here, doesn't give anyone heartburn, but feels like we can have our council review it. And then once the Oversight and Accountability Council begins review, that's a second opportunity for council members to look at the recommendations we put forward, ask questions, even ask about entities that maybe got no's or weren't considered, or what the original budget was and how we came to a conclusion about the package that we put forward. So that's a second phase. And then after that, even once the grant administrators begin connecting and writing, working with OCMP and the grant writing, there'll be other details that will go into that process that will also make sure that any concerns we put forward or the council puts forward can be addressed, right? And those are concerns that wouldn't have us say no, but we might say, hey, let's just make sure that this is happening with that money in a very specific way. So I want to pause there and see if that alleviates any angst or feels reasonable, or if there's any other questions that I can support before we get started. Judith or Jude?
Hey, Sam, sorry.
Hi. No,
Sorry
it's
I
okay.
raised my hand so fast. I was like, so I have a couple of questions. First, thank you for clarifying that. One, so is it permissible for this group as they look at counties to say this county did not meet the particular, does not have a full burn, right? And this needs to happen. Is there going to be notification, or are grantees supposed to be watching this process to know that they have been removed from consideration? Because my understanding is there's an appeal process.
That's correct. So there is an appeal process that can happen. So of course, if somebody, if an entity does not receive a yes in a process, they would be notified there's an appeals process. This is obviously being live streamed so that it's a transparent process. And then, even as we move past the review panel and the OAC's review, there will still be likely some negotiation, particularly in counties where the difference is substantial.
Yeah,
and we'll see those a little bit later.
Okay, and then my third question is, having reviewed the documents and answered the questions as exactly as they were posed, so not like to get things here to have the discussion, looking at the key metrics that people put in, is that going to be negotiated so that those metrics actually look at efficacy and not just numbers? Because serving 100 people or touching 100 people doesn't necessarily mean moving them in any way. That's just a process metric. Is there going to be, or is what someone put in their application going to end up in their contract?
So the application, a couple things. One is we review, we're like, this seems reasonable. There's, this is something we would put forward to the council for their consideration. Then the council would review. Then there is the process of negotiating, and then the contract administration of the work. And I think where you're getting to is where you're talking about, saying you serve 100 people is different than saying that 100 people received a specific outcome that may be outlined in an application. That is the work of grant administration.
Right. Or the intent of the the legislation. So it's not just serving 100 people, it's
Right.
providing quality service to 100 people to meet.
That's right. And that really is the grant administration and the reporting requirement. And then also Abby and the M1 team really building out the behavioral health resource networks as a network. So that is part of that work going forward after we have the applicants approved and decided upon.
And my last question, I promise, is there a way that we can know if an applicant is the, I mean, I know there's the question about whether or not the stuff is the task or activity is billable, but whether or not we can know which applicant is the CCMHP or the CC, you know, if they're actually, what would be equivalent in public health to essentially the local public health authority?
I think we can. I think we do have the ability to look to say, hey, can anybody bill Medicaid? Who's doing direct service? And yes, Dharma just put in the chat they aren't always an applicant. So that is also true, but we'll do our best to answer those kinds of questions.
Thank you.
Thanks, Jude. Anything else before we get started? Okay. I think today we're going to go in alphabetical order. And Carly, if you want, thank you. Appreciate it. Carly is navigating the screen share today. So, you know, we make sure that I don't disconnect us essentially. So Baker County is our first review, and we want to do a call for conflicts. And I'll pause and see if we have any potential conflicts or actual conflicts with Baker County. Okay, I think we can move forward. Next slide. Okay, Baker County. So this is just a review. We've seen these slides before, so I just want to make sure that we go through them quickly and also have time for the actual review process, but happy to answer questions. We had 331 applications were submitted for consideration. 320 passed the minimum submission. We did review and scoring, and we're here now where reviewers are flagging key considerations and looking at making a recommendation for the council. And then the Oversight and Accountability Council will make the ultimate funding decisions and vote on final funding amounts and the awardees. Next slide. This is just the objective and goal set by Oregon administrative rules. And just reminding everyone that for each of Oregon's 36 counties, this review panel must complete a successful majority vote on funding recommendations for the OAC's consideration when building out the BERNs, the Behavioral Health Resource Networks. Next slide. Introductions, I will just say Sam Byers, Adult Behavioral Health Director, and this week I'll be filling in for Abby. We are looking at doing 5 review panels and have our Oversight and Accountability Council be able to begin to review county BERNs on Wednesday, tomorrow. This meeting, as you know, is a live stream public meeting, so please refrain from sharing protected or sensitive information. The chat feature is closed to keep the discussion concise and also to make sure that it's all captured. You all do this, but raise your hand when you'd like to speak, and please wait to be called on. Asking for condensed input. We do have a very big job and a very little amount of time to do it. We can look at some of the details or hear about some of the details of individual applications if that's needed. If you're a reviewer, we may ask for your input, particularly if that's helpful to move the work forward. And votes will be called at the end of each county discussion. And I think that covers the housekeeping. Next slide. This is just a reminder of the funding formula that was approved by the Oversight and Accountability Council. It's a baseline funding formula and a reminder that the OAC may choose to make decisions independent of these particular amounts. And chat is captured on live stream. Thank you. Taking a second to take a deep breath as we move forward and begin to see if we can approve some counties today for the council to review. I'll just give everyone a second to get ready. Take a breath or do whatever you need to do to feel comfortable in the space that you're sitting today to do the work. And with that being said, next slide. Okay, so we'll do a county overview. The applicant requests by service area. We'll review the funding requests, the formula funding and the reviewer recommendations. And then ultimately, if we need to really look at the prioritization to meet the formula guideline and then identify a potential burn to put forward to the OAC. Next slide. Okay, Baker County, Eastern Oregon, you can see the population, 16,685. The median household income, a little over 51,000. Racial composition, 89% white, 5% Hispanic Latino, 1% Native American, 1% Black, and 4% other. 13.7% in terms of poverty rate, higher among minority groups and non-working individuals. You have the age distribution there, with 53% sitting at ages 18 to 64. 37% of households are in the low to moderate income, and the unemployment rate is 5%. Also noting that its economy relies on agriculture, mining, and outdoor recreations. And the challenge for Baker includes higher than average poverty rate. All right. So for Baker County, the countywide formula was $2,126,372.98. We received 2 applications. Both applications had a passing score. The ask is $2,402,901.35. So the countywide difference that we have is $276,528.37. Next slide. For screening, New Directions Northwest put this in as a service area at over 132,000. Next slide. New Directions also put in for assessment. Next slide. For substance use disorder treatment services, both Boulder Care and New Directions Northwest requested funds for that service area. And then for peer support, both Boulder Care and New Directions Northwest put in for funds. Harm reduction, both entities put in for that service area and funding. And housing only, New Directions Northwest. So when you look at all of it together, the green is where we have the reviewers, both reviewers said a yes to the applicants. And then on the final column, and Kathy, correct me if I'm saying this wrong, the column where it is 11,000 or 212,000 are the program costs. So the overhead costs that comes with the work as opposed to the direct client services.
You're correct.
Okay. So as we're looking at this as a review panel, I want to open it up for discussion and any questions and hear from you.
Can you clarify the program costs definition?
Yeah, Kathy, can you go ahead and outline what was included in the program costs?
I believe Jason has those.
Oh, sorry. Yep.
Well, I mean, I can pull up specific ones, but just in general, the directions were to put program costs for anything that were not directly tied to a service. So anything that would be an overhead cost, like program staff, rent, things like that, that would be a cost no matter which services they were or weren't approved for.
Program costs are typically, it is sort of the administrative costs, the costs for, kind of keeping the lights on in the office where someone might be. Dana?
Yeah, could we get some information on why one of the reviewers did not recommend harm reduction for boulder care?
Do we have the reviewers here?
Yeah, just trying to make sure I raised my hand.
Thanks, Hannah.
Yeah, so with this application, so they had spoke about going through like the Save Lives Oregon, and then as far as the program delivery, I have made note that it didn't fully demonstrate how the harm reduction services will be conducted. They did share that it would be naloxone distribution. Let me go through my notes. Naloxone distribution and testing strips, and that they go through Save Lives Oregon. So I made a note that for most of their parts of the application, it was detailed, but it wasn't specific to the county. However, my notes were however, the application was complete for the most part, and services were outlined. However, to prevent double dipping of funds, it's important to call out that they go through or Save Lives Oregon for harm reduction supplies. So that was my, that was kind of my recommendation for that. And that it wasn't specific to, some areas just weren't specific, but I can go through, let me go through my notes and allow others to also share.
Thanks, Hannah. Jude?
So I have questions related to the other areas, the SUD and the peer support and the housing. So when we get to those, but for the harm reduction for the two agencies, can you say exactly what they're planning to do? It sounds like how many people they're planning to serve, Boulder Care in particular, and does that match the number of people going into their SUD and peer support? You know what I mean? Like harm reduction.
Well, also,
yeah.
Sorry, Jude. I wanna try and keep us focused that right now the only places where we have two reviewers agreeing for harm reduction is with New Directions Northwest.
Okay, if we could have New Directions Northwest, if someone could tell me what their planned activities were.
Yep. Thank you. Kylie, is that you?
Yeah, I'm pulling it up.
Thank you.
Did you say harm reduction for
New Directions Northwest?
That's right. Okay.
I do have that pulled up under the project scope. NDN is committed to a harm reduction model that prioritizes safety, education, and health, even for those who are not yet ready for abstinence-based treatment. In the last 2 years, NDN has expanded its harm reduction services, including naloxone distribution and overdose prevention education across the community, syringe collection sites to minimize spread of infectious diseases, wound care for those at risk of infections, health screenings, and referrals to medical or detox services. These services have provided a safe and supportive environment for individuals using substances, offering a pathway into treatment when they are ready, while preventing harm and death from drug use in the meantime.
Thank you.
Thanks, Kathy. Carly, can we go to the next slide just briefly? Just wanted to remind everyone that even with the 2 yeses, where we're just looking at the green boxes, we are still looking at an amount over formula that's $234,902. So when we go back to the previous slide, sorry to make you jump around, Carly, on this. Just looking at those numbers, just in the green box, are there any thoughts or considerations that you'd like to hear about in terms of where we could potentially balance the budget or put forward a budget that is within the, the amount that, at least the base amount that's been allotted? Keisha?
Yeah, I was wondering, I know she just read off the harm reduction, but was there staff in there? I mean, because to me, it's a little high for harm reduction.
You're looking for their budget information?
I have the budget. So we're talking New Directions. Is that who you're asking about, Keisha?
Yeah.
Production? Okay.
Yeah.
Just to make sure. Let's see. So yeah, I'm trying to, they have a total of, in their staff, they have a total of 110,000 about. I'm trying, it doesn't break out which in the budget, which parts of the FTEs that is covering, or what specific staff that's covering.
So Jason, just to be clear, the 132,000, the 110 of it is for staff. Is that for harm reduction staff?
Yeah.
Okay, thank you.
And then, yeah, and the other 22 is for services and supplies.
Okay. Keisha, did that help?
Yeah.
Okay. Thank you. Jude, before I go to you again, Ron, I see your hand popping up and down, and I just want to make sure that
I guess
my
question was really around the your last question to us regarding the balancing the budget, and my question was about burn negotiations. Is that still a process that happens where the providers who are essentially moving forward, would that happen after this, or is that not happening in terms of the burn partners, potential burn partners who are approved getting together and
so my understanding is, and I will have the team correct, is that the negotiations would happen after even the OAC review, but I want to make sure that the 110 team that have been working on that process specifically, that I'm putting that in the correct order.
Right.
Yeah, that is correct, Sam.
Thanks.
Right. So the question that you asked, is there something here that we can adjust? That's why I was curious why that was being posed now, because that process is likely to happen later with the partners.
I think that the review panel process, as it is, at least in this phase, was to have the review panel come up with a recommendation that even would say, absolutely yes on this, and, maybe a certain
Right, you're saying
service area was a little bit high, and so we
I
could
see what you're
put
saying.
forward. Yeah.
That it's possible to suggest tweaks at this point.
Yep.
Oh, all right, thanks.
That's right. And I don't know if our reviewers, other than Hannah, are on. Jude?
Yeah, I just wanted to point out, because I know we're looking at the harm reduction budget amount. So given the size of the county that you outlined, it would probably be a small SSP, and operational costs for a small SSP just for preventive services, which is what they described, is an average of 100,000. If they have a van, you're adding on another 40,000. So I don't see that number as the only, as a number that's out of range, as, this is in literature that we've looked at for OHA estimates in the past. I just wanted to put that out there as if people are thinking about funding.
Thanks, Jude. Keisha, is your hand still up or have another question?
Nope, I thought I lowered it.
That's okay. Thanks. Emily?
Hi, Sam. Just for clarification on our role, are we looking at looking at a service area and saying we would cut a certain amount of funding from a given service area, or are we looking at like a service area as a whole?
I think what we have is yeses across the board here, right? The green, and it's a matter of, if the reviewers are here, it would be helpful if they were like, this all seemed within reason, or if it was like there was a little bit higher cost here that we could, reasonably hear about and look at.
Okay. Because it seems, from my perspective, and I was a reviewer for New Directions, challenging for me to know what would make the most sense for the organization on where to cut, right? Because it might be easier for them to say like, oh, well, our program costs, like we can actually do without those. But like, I can't say that. So I don't know, our role seems a little funky to me on trying to reduce these amounts when, like what Ron was saying, it might be something that they just do in their negotiations in a more effective way for them.
Dana?
Yeah, could I get some budget details in regards to the assessment? How many lives they're anticipating on serving? Is this also for staffing?
And just to clarify, this is still New Directions?
Yeah, because Boulder
Okay. Oh, yes, I'm sorry. Boulder Care didn't apply
Yep.
for that one, sorry. And so you said in assessments?
Yes, please.
Yes. Okay, so of the it looks like everything in assessments is staffing costs. So that is, and again, that doesn't break out like what FTEs that applies to within this assessments. Their FTEs are more listed on the program level. Does that answer the question?
Well, and to the second part, I think, Jason, was the number of people served.
Gotcha.
And so in the milestone chart, it appears that their goals for year one for screening are about 52 participants and assessments 50. And then incrementally progressing to the fourth year with about 70 folks, 69 folks for screening and 67 for assessments. So a total of adding about 17 to 20 folks over the 4-year scope.
Keisha?
Oh, sorry. I was going to ask the same thing about assessment.
Dharma?
I guess I'm a little confused about folks waiting or suggesting we wait till this is in like negotiations, because like I wouldn't want to vote on something that was over budget, like just to have it hopefully get taken care of later. And so I guess for me, it feels like something that we should prioritize resolving those overages now rather than sending it on with an overage that has to get resolved down the line. And there's, I guess because it would go to the OAC anyways after this, and I don't think that having it with an overage would be helpful, just in my opinion. Is there a reason for the big I guess in Boulder Care's program costs, are they also covered in other counties that they're applying for? Do they separate those program costs that they're utilizing per county? Like, is that, or could it be covered through their other grants?
On the budget side, Jason, I don't know if this is you, but are the numbers that we're seeing for Boulder Care specific for Baker? Or is it like specific staff for Baker, or is it just the costs that they believe they would need to serve Baker County?
In the program cost, correct. There is no narrative, so it's just a dollar amount in the program cost, but it should be, if they're following directions, it should be what is applicable to the county.
Okay, thank you.
Megan?
Hi there, thanks, Sam. I just have a question. If we're talking about funding for sub-treatment, how is that related to, like, if organizations that are applying can bill? My understanding was that I'm just wondering if that's something we're taking into consideration when we're reviewing applications. Thank you.
I'm sorry, Megan, you were echoing a little bit for me, so could you repeat the question?
Yeah, I just have a question about billing and if organizations if we're taking that into consideration for like folks that are billing Medicaid for services and applying for like things like sub-treatment.
Yep. To the team, do we know, I believe New Directions Northwest is eligible for billing Medicaid. And I wonder if Boulder Care is. Is there anyone on the team that could speak to that?
I'm checking our
Thanks, Kathy.
Thing. I believe that they can. I need to figure out which.
I know New Directions can. On the sub-treatment side.
So it looks like in different counties, so Boulder can or cannot. There's some of it where it shows no, but then there's other ones that show yes. So
okay,
it's probably county specific.
Does that help the review panel?
Can you read?
And sorry, I didn't raise my hand, but so in question 2 of their fiscal narrative, they do partner with OHP and the local CCO in Baker County, and they bill for their clinical services, but they intend to use M110 funding for costs not covered, such as peer recovery, case management, and other patient support services.
Thank you so much, Hannah.
Thank you, Greg.
Yeah, I just want to say that some of these agencies get service element funds for certain services to bridge the gap for folks that don't qualify for Medicaid. So indigent funding is also provided through service element funding.
Thank you. Keisha?
Yeah, I was just wondering, I just heard the narrative around the SUD and then being able to bill for services. So I'm just trying to figure out, are they putting peer support under SUD, and would that be the appropriate place? Because it's not really treatment, but it is peer support.
It looks like peer support is actually separated out from SUD, that they provide all of the services.
Okay. I just thought I heard him say that they were billing, I mean, they were using M110 funds for the services not covered under SUD. Maybe I
Oh,
got it
yeah.
confused.
Jason, can you reiterate that again?
I think that was Hannah's comment that
Yeah.
Oh, Hannah.
sh- let's see. So in their question two, yes, so they did share that they intend to use M110 funding for costs not covered, and then they mentioned peer recovery and their and case management. But they do intend to but they did mention clinical utilizing OHP and their CCO and billing the CCOs for clinical services. So I assume that would be related to the SUD cost, but I feel like it would be helpful to pull up their fiscal analysis or their fiscal narrative. Or I can do that. I just need a moment. But this was their question to please describe how your organization plans to use grant funds for services in a way that would not supplant Measure 110 covered services. And so that's what I indicated, if that's helpful.
So it does say that this is what the question number 2 about the supplanting comment is, and it says partners with nearly all Oregon Health Plan CCOs to provide services to existing patients and will first submit claims for reimbursement for clinical services to OHP entities as primary payers for enrolled members referred by the burn. Standard Oregon Medicaid fee for service rate cards only cover 37% of Boulder's total cost of care, which includes additional non-covered services such as peer recovery, case management, and other patient support services described herein.
So, Keisha, I'm going to give you the last question. We're over a half an hour in on Baker, and I want to make sure that we have the opportunity to make a motion or consideration. We know that we have, and Keisha, I'll let you ask the question when you go ahead and ask first. Let me do that so that you have that.
I didn't put my hand down. I apologize.
Oh, okay. Okay. No problem. So, given the information that we know, including the ability to bill and offset some costs with Medicaid, do we have a motion? Amy.
I'd like to make a motion to forward this to the Oregon Accountability Committee for review and for budget reconsideration.
Oversight in the
Yeah, I want to forward it to the committee.
Council.
I second.
Okay. And to be clear, we're moving forward Baker County for the Oversight and Accountability Council to review and look at the budget decision once it gets to them. Okay. And we have a second. Carly, let's go ahead and take a vote. And I'm wondering if we can do it by show of hands just for time's sake.
Absolutely. If everyone wants to raise their hand that is voting yes. And it looks like the motion passed with 20, wait, it's adjusting. Passed with 27.
Thank you. I'm wondering, Carly, could we go to Harney County? Because I know that we reviewed that and we got some DOJ guidance. So I want to bring that to the review panel.
Yes. Give me one moment to pull those slides up.
Thank you, everyone, for the vote.
Okay, let me share my
And
screen.
I see hands up, and I don't know if it was for the vote or if there's questions.
Let me do that again. Is that showing correctly?
The call for conflicts, I see, I see two hands up. Mark, do you have a question? No. Jude?
Yes, I had a question. So with this last county, we just voted yes, and we have I don't have any idea what their housing service provision was, and I don't know if there's a way to go through each of the sections. Like, we spent a time because there was more than one harm reduction, but to kind of understand what kind of housing services did we just recommend for this county?
Yeah, I think, Jude, that as we review, what you're seeing is you have two reviewers that said yes, that the housing proposal made sense. I think if we want to ask about that during the review, that's great. I think the idea of the review panel is to make sure that there's nothing that looks that it would be of concern, that it would be unreasonable for the council to review. But the council can also get into some of those details in terms of the work as well. But
okay, and then maybe I was too literal in my reviews, because the question was, did they answer the question? So when I guess in the reviews I'm doing now, I'll be more specific, but people might have answered the question but still not created a full spectrum of housing, because we only saw you see a smattering, so you don't see when you're doing a review what's
right. So just to keep in mind, Jude, the reviewers and the score confirmed that the applicant did answer all the questions and provided information that met the criteria of the scoring rubric that we had. It'll then move forward for more discussion with the OAC just to get some more of the details, and then of course we have the actual grant administrators that will be looking at the details of that. But I think if there's questions of concern, we want to bring them up, and the review panel can still vote moving things forward and forward their concerns with it as well.
Yeah, excellent. And since we have OAC members on this, they're hearing the discussion, so they'll know that that maybe stuff didn't actually get discussed because it was reviewed by the two people.
Yep. Thanks. Okay, Harney County, call for conflicts. Conflict of interest, potential or actual. All right, next slide. We're going to skip all of these beginning slides and go straight to the Harney County. Okay, so reminder, Harney County, Eastern Oregon, 7,496 residents with a median household income of 50,748. A low to moderate income, approximately 45 to 50% of residents meet the HUD defined threshold. 55% of folks are within the age group of 18 to 64. Poverty rate is 12.1%. Next slide. The countywide base funding formula was $2 million. We had 2 applications that passed scoring. The countywide ask of the combined applications is $150,086.66 over, and it is Boulder Care and Symmetry Care that submitted applications. Next slide. And next slide. I think we can skip through these because I want to get to the green. Yep, thank you. So when we last met as a review panel to talk about Harney County, there was a question about that the review panel had and said, you know, this is really challenging to
I
even
probably
make
didn't get it because I've been in the field all day.
Oh, Melinda, I think you're off of mute. Thank you. So we had put forward that it was hard to make a decision when Cemetery Care's amount was not broken down by service delivery area. We received information from DOJ that we cannot actually contact them and ask for that would compromise the actual review process, but that we could you know, vote on Harney County, move it forward as we as the panel as if that is something you want to do, and that once we get into the negotiation phase and contract development, then that can be start to look at the details of how much goes to screening, assessment, SUD, and peer support. Keisha?
So did they in like 1.8 million in program cost? In the guidance though, wasn't it? It can't be over 10% of the budget, even though they put it all over there, but wasn't that the guidance? And I'm just wondering how they keep passing and all the program costs are so high.
And just to clarify a little bit, program costs are not the same as administrative costs. So administrative costs are 10% max, but administrative costs could be applied to the service area and the program area, both. The program costs would include other things like program staff, you know, like if they had an office manager, different things like that they could put in there that would not be part of your administrative costs. Those costs that aren't specific to a service area, but are needed for the program to operate.
Thank you for that. And then I'm just wondering why they're not in service areas so we can make it a clear decision.
Yeah, unfortunately on this budget, rather than, unfortunately, they didn't really follow the directions on how the budget was supposed to be filled out. So all of their staffing and all of their program staff training costs were all in the program cost area. So they were not broken down amongst the service areas, but clearly they're making up the FTEs that are supposed to be doing the work in those service areas.
Right. Yeah. That's just my
process.
I don't know if the specific conversation. I'm not sure if the specific question's been asked, so I don't want to speak for DOJ. And I do want to back up a little bit. So there's a little bit of a difference. So this review panel does have to do the best job it can of recommending someone for every service area. So, and having so the blue areas we would want to potentially include to the council because we don't have greens to fill the gaps. And then the council gets to make that decision from there.
Got it. Carly, can you go back a slide so everyone can see Boulder Cares? Thank you. Amy? No.
Sorry. It was my understanding, right, that our recommendation, our job is to recommend this moving forward with our concerns to the accountability committee. Is that correct, right?
Yep.
So if hypothetically we were to move this to the accountability committee, who are the ones who are going to make those decisions and
the best job practicable to pass forward a full burn to the council. So I'm not sure that we can just say no.
That's not possible though. If that's not possible, if it's only harm reduction in housing, that doesn't feel like a full burn.
So so you just mentioned that that there were applications that I think I heard you say applications that were that would be eligible for consideration by the review panel. Is that correct? Other applications in Harney County?
No, this is the entirety of the Harney County applications.
So there were no more applications.
Correct.
So would it be possible that where we're at, to ask the providers in this county to provide us with more detail on their budget, and then we can table this instead of saying no to it. We can table it and revisit.
My understanding is we cannot, we would compromise the review if we reached out to the providers at this point in the review process. So we can't. It would actually be during the negotiation phase, which is post the Oversight and Accountability Council review.
So if we were to move it forward and then the council were to approve it, and then it went to the negotiation phase, it would be during the negotiation phase, we'd be able to request more build out of the services.
Correct.
It'll be a done deal. We can't request nothing to be solidified.
Well, I just heard that we could.
In negotiations is post council, so after the council, so we couldn't. We won't get to have any more information, period.
You know, we can, the other option is to pause on Harney County, and I will, I'll do a direct consult with DOJ myself and get the details on what our options are here, and then bring it back tomorrow if that feels right for the review panel, as opposed to struggling in terms of understanding, you know, what we can and can't do collectively.
Do we need to rescind the motion on the table, or can it just be sitting as is?
I'm sorry, say that again, Dharma?
So are we going to vote on the motion still, or are we going to wait to vote on the motion pending the response?
That is one option, is to pause on Harney again to get a better understanding of DOJ's recommendation or direction and guidance. Morgan?
Yeah, just on that point, I would love clarification here of like what these two pathways are, because if they're saying we can't get more information until we're in the negotiation stage, and then what are we only negotiating with that specific service provider who's applied, or is there some mechanism there that in negotiations we're then looking for, you know, being able to talk to other organizations? I'm just confused here. Like, what happens when we do not vote to move something forward? What happens when we do vote to move something forward? Like, what is this flow chart looking like?
So there's a couple of things working and trying to determine how to get a burn in that area. Oh, okay, and we have to address the motion that's on the floor. Okay, can somebody reiterate the motion that's on the floor? Because we've had a couple. And I'm gonna see if I can pull DOJ in too for us right now.
That was Dharma that made the motion to not move Harney County forward.
I'll rescind the motion so that we can move forward if we table this. Yeah.
Thank you.
Thank you. And Kathy, would you forward the our review panel invite to Shannon, who might be able to join us?
Yes, I will.
Thank you. Sorry, Amy, go ahead.
Well, I think so. From my understanding, we could move this forward, and our recommendation to the Accountability Committee is that they review exact program parameters.
We can't.
We can't do that?
No, it's still going to be in the same. It's still going to be in the proposal stage. So we can't go back to them even at the OAC level and ask the questions that we need to ask. So we should just table it for now and move forward.
Either way, we're gonna end up stuck on this county. It sucks. Okay, thank you, Dharma.
Dana?
Yeah, Symmetry Care is in another county as well. Is it possible to discuss Symmetry Care in general with DOJ, not just specific to Harney? Their application was very, very similar, and same concerns were risen.
So yes, I think, and we are trying to have Shannon join us just to help understand, like, what do we do when we have an example like we do now, and all of us as reviewers and the council will likely want to understand how the service areas are being addressed in that county, or if they're literally not going to be, right? And then how do we move forward with that area?
Yeah, I think that would be helpful to have more of a general answer than a county specific answer for Symmetry Care.
Yep, that makes sense. Anything else? Kathy, anything else we need to do?
I don't think so. Shannon is here.
Ah, hi, Shannon.
She just coming in.
Oh, she's connecting to audio. Hi, Shannon.
Hey there.
Hi. So, Carly, can you bring up the Harney County slide that has both Boulder Care and Symmetry on it?
Yes, one moment.
Thank you.
Mm-hmm.
So Shannon, we just wanted to make sure that we're following the guidance correctly as Carly brings up Harney County. We had two providers, one is Boulder Care and one is Symmetry Care. Of the two reviewers, only, I want to make sure I'm saying this correctly, only Symmetry Care received 2 yeses by the reviewers. However, when you look at what Symmetry Care provided, it did not break down the program cost across the service areas. And so as a review panel, there were some questions about whether or not we could find out how that was being broken down. My understanding was that we weren't allowed to, that our guidance is that in order to not compromise the review process, that we could not reach out to Symmetry to ask for the breakdown of their program costs. And I think as a review panel and council, just trying to understand how, what pathways we might have to move forward, or if we really just can't move forward if we don't have information that feels necessary to make a good decision.
So if I'm understanding, Symmetry Care is proposing to provide all the services, but they didn't include any information about how much of their budget would be spent in the other areas other than housing and harm reduction?
Yeah, Shannon, what they did was all of their personnel costs and all their training costs, they rolled up into program costs. And so only services and supplies, basically housing and harm reduction were the only ones that they were proposing any services and supplies. And so that's why they have individual costs there. But otherwise, everything was just under the program cost column and not broken down by all the different service areas that it would apply to.
But clearly from their application, they want to provide all of the services.
Correct.
I mean, I'm trying to remember, Sam, my exact, sort of conversation with Abby. I would not recommend that there be any communication with applicants that would seem to be allowing them to sort of amend their application in some way. I think if what you intended here is to ask for clarification about how they intend their budget to work, which is sort of like a request for additional information, that probably is okay. But we just can't at this point, right? People can't amend their application and sort of submit information that they didn't have. And ideally we sort of wouldn't be doing follow-up, but if it's necessary to move forward.
Dharma?
Yeah, Shannon, I guess I'm wondering too, if at this level of the review panel, if we decline to move this forward because we don't think it's practical to do so, is that something that could cause like a targeted recruitment from OHA, or is that something that we can do at this stage, or is it something that we have to stop, move it forward, and then deal with later? I guess I'm just confused about that.
I mean, if you were to sort of Dharma, I'm not totally sure I'm understanding, but if your funding recommendation was to only move Boulder Care forward and leaving a gap in services, you know, that certainly would not be ideal. I mean, the other thing I think that Sam, that Abby and I talked about was, you know, you could bring this forward to the council and say, you know, you know, it would be possible for the council to move forward with Symmetry Care, but you would need, in the negotiations, right, there would need to be more information gathered from them about how they intended to spend money related to these other services and do it that way. So it would be sort of something like you saw from the council previously, where it was sort of a conditional approval.
So then would the council have the opportunity to review again once the breakdown was provided in negotiation and then make a final vote?
Yeah.
How does that sound to the review panel? So that means that there's well, the first easiest pathway is that this would move forward with some level of emotion, saying move it forward to the council with the concern that the cost breakdown isn't there, and that you know, any additional move forward would be provisional until that's understood through negotiations. I think the second question is, can it move forward with an understanding that there can be a specific request on the 1.8 million and where that's going? Or is that better to do it the first way?
I think you could go either way. I mean, I certainly understand why, you know, to help OAC move things along, having more information to present to the council to begin with. Again, I would just be very careful, right, that you're not asking for, you know, them to amend any application materials. It's just an explanation, given the way that they sort of set out their budget, how they would intend to support these other services.
Dharma?
Well, and just to be clear, Shannon, so if we decided to not move forward any applicants for Harney County, it would just stall? Like would they have to renegotiate it and find new applicants, or would it cost a second request for proposals? Like, what would that process be if we didn't move any of them forward? Not leaving a service gap, but not moving the county forward.
I think that's sort of a bigger problem, because the provision that allows you to go out and sort of do more targeted grant making is after you've funded all the burns in all the counties. And so if you haven't done that, I don't think that you can sort of move forward with a different process. That's the, you know, my off the cuff answer.
Amy?
So would it be hypothetically, possibly officially, but hypothetically appropriate to say we could move forward? We would like to move Harney County forward to the accountability committee with careful consideration and explanation on program parameters.
Yeah.
Symmetry Care?
Right. I mean, I think the council could sort of vote and say, you know, we conditionally move to approve Symmetry Care with the expectation that OHA is going to come back with additional information in negotiations about how it intends to use grant money to support the other services.
So basically stating, I would like to make a motion to move Harney County forward with the consideration for the accountability committee and OHA to give special consideration or to the budget of.
Maybe Shannon could say it again.
Yeah, because you can just either write it down or say it again, or could you make the motion? I know.
No, I definitely cannot make a motion.
I was trying
and
to
I'm sorry,
say it
I also did not introduce myself, so apologies.
Sorry, I just want to say it correctly.
And I think
Get a cutting board.
Amy, it looks like Kathy put some language in. See if that makes sense in the chat.
Okay, so I want to make a motion to move Harney County forward with careful consideration. Where did it go? Careful consideration around the program parameters and budget explanation.
Melinda, that was a second. Jude, I see your comment there, and I think that will also come out for the OAC at that point, and then also particularly through with our grant administrators. So if I heard correctly, there's a motion to move Harney County forward to the OAC with careful consideration around program parameters. And Melinda, you did a second to that, if I'm correct.
Yes.
Shannon, thank you. And Carly, I think we're ready to vote.
Okay, if everyone can raise their hand for a yes vote. And that passes. 23.
Thank you. All right. Well, we have 30 minutes, I think. Carly, maybe I'm trying to think, what about like I think we have Coos, right, available?
I would say Columbia is probably
Columbia, that's right.
one.
Yep, great, Kylie. Let's do Columbia.
Okay, give me one moment. I had Benton up.
Thank you. And I know I see hands raised, so if there's any questions, keep them up, and I'll call on you as we get the slide ready for the review panel. All right, Kathy.
What? Oh, I forgot to put my hand down.
Okay, great. Sarah? Nope. Okay, we're good. All right. Columbia County is next up for review. This is a call for conflicts, both potential and actual for Columbia County. All right. Let's see our Columbia County. All right. Columbia County has a population of just over 52,865. The median household income is 83,265. It is heading towards the north coastal area and has largely a rural character. The racial composition, can see, and the poverty rate at 9.1%. 60% of the folks are aged 18 to 65. Unemployment rate is 4.16. And Columbia County's population is a mix of families and retirees. That's interesting. All right, next slide. So the base countywide formula for Columbia County was 5,964,830.41. The total applications submitted were 5, and we had 5 applications that passed scoring. The difference between what the county has asked for and what is their base formula is 9,763,197. So this is where we get to the place where we are looking to build out a burn. And as Abby said, there are going to be moments where we may be saying yes to some providers and no to others in a desire to actually fund completely. So on this ask, you can see reviewers did say yes to a provider or multiple providers in all of the service areas. And I'll just pause here and open it for discussion. Zeb.
I apologize, but is that number right for the peer support? 2,300,000 for is that number right? For Columbia,
Back to basic recovery line.
Columbia County Mental Health.
Columbia County, 2 million. Yep, 362,000.
Okay, and then back to basic. All right, thank you.
Yep, no problem. Amy.
That some high asks there, but I just was wondering, so I'm not affiliated or nothing, but I've heard of Medicine Wheel, so I'm looking, I like their figures, their numbers. I question the peer support amounts, but based on what was the amount of people in that county again?
Was it 52,000?
52. Okay, it was in the 50. Okay, all right. I think I don't know. I just think for me, I would be apt to make a motion to move this county forward with the accountability committee looking at the needed adjustments.
Dana?
Yeah, could we take some time to look at the housing option that's available there for Iron Tribe? Just a little bit more details in regards to what services or support we're discussing there.
Yep, please.
So currently in their project scope, their housing, they currently operate 33 homes across 7 counties in Oregon, providing 244 rooms to those individuals. So that's globally. And then I'm trying to figure out where it says specifically for this county, because I believe they've applied in other counties. So I don't know if Kathy's found anything specific.
Which one were you looking at?
I was looking at the project scope for Iron Tribe for the housing component. And while they have past experience and do this, it looks like a statewide level. The specifics right now, just for Columbia County, are a little lacking in the application. I just didn't know, Kathy, if you saw more.
I was trying to get into back to basics, but I can't find any documentation in the folder, so I don't know if it's just my machine or what. So I wasn't able to get any of that on. I don't think the fiscal and technical narrative will have much information about that.
Kathy, while you're looking, Jason, I just want to ask on on another slide, there is the ability for the review panel to begin to look at putting a burn together to meet it within the funding formula, the base funding formula. Is that correct?
I'm sorry, I was responding to Ron's chat or question in chat, and I didn't catch the first part of your
Well,
question.
just that, we have multiple providers, right? Offering a similar service, but in order to come closer to the countywide formula, the base formula, we do have a slide where the review panel can begin to put a burn together. Is that right? To see?
Yeah,
if
I
you
have
keep going.
I have a spreadsheet if we want to if we wanted to play. I mean, there's more slides here, but then also we
okay, great.
If we want to do a little whiteboarding
Yep.
on, yeah.
Let's keep moving forward on more slides. But Keisha, you had your hand raised, so before we do that, I want you to ask your question.
Yeah, I just want to see the breakdown in the peer support for Back to Basics and Columbia County Mental Health. And then are they billing also, and how many people they plan to serve?
Great.
I have a response for the housing for Iron Tribe to answer that question. It looks like year one, the goal number to serve in housing is 24, and that increases to with that and rental assistance in the housing component. They'd like to serve 24 folks with housing and recovery homes and 100 folks by the end of the 4 years for rental assistance.
Okay, so it sounds like predominantly it's rental assistance. Is that correct?
There is also a housing component. Clients housed in the Iron Tribe Network Burn Recovery Home. So this must be one of the 33 homes they discuss in their overview that is statewide. But this is pertinent to Columbia.
Thank you for taking the time to research that for me.
Absolutely.
I also found in the fiscal and technical narrative for Iron Tribe that they operate 24 self-pay homes across 7 counties, providing essential housing solutions to those in need. These self-pay homes operate without any external funding, making them a sustainable model for our organization. Additionally, we receive annual grants from the Meyer Memorial Trust. So this is underneath their sustainability part of it. And so looks like they have other sources that they're able to support the housing as well. Their organization also has been awarded grants from Pacific Source CCO and Columbia Pacific CCO and the Ford Family Foundation. So that's under their sustainability, if that's helpful.
Thanks, Kathy.
I've got some info regarding Back to Basics. Was that one of the questions regarding the peer support?
For peers, it's Back to Basics and Columbia Community Mental Health. Just some of the details of the work they'll do, and then how many people each of them will serve.
And billing.
Okay.
If you have Back to Basic, Kylie, I don't have access to that. But I do the other one.
I might be just ignorant to name changes, and somebody might have a little bit more historical knowledge. But within the project scope, Back to Basics Recovery will fully adopt 4 dimensions recovery, administrative and programmatic service protocols. But it does not, they're not appeared to be. Is this, and maybe somebody can clarify, is Back to Basics the same as 4D?
No, fourth dimension is another burn, and I do know that they have offered their accounting services to other burn entities that they've worked through, so that could be just some support from them.
Okay, because it appears within this scope, their 4D recovery is also providing peer counseling and supportive experience. So I'm not sure if that's if that is a subcontract or a pass-through funding that Back to Basics is doing with 4D. It looks like that this is what they say in the application. 4D Recovery has extensive experience in providing ongoing peer support services. 4D's recovery peer philosophy is rooted in the belief that people can overcome substance use disorders when provided with the right tools, and peers offer hope that make it possible. It says, let's see.
I wonder, Kylie, are any of the reviewers present that can speak to you?
That would be helpful for sure.
Yes.
For Back to Basics recovery, anybody?
Is Nicole Silva on the line? She was a reviewer.
And anybody else that?
John
McElveen, he's not here.
McElveen.
Okay.
Hey, Sam, this is Jude. I reviewed Columbia County and can talk a bit about their budget, from what I'm remembering from their application.
Do you want to speak to Columbia Community Mental Health?
Sure. So when I looked at their application and what I can remember, because also, looking at there was a significant peer support, they are leveraging peers with the billable Medicaid that they have. They're going to be running peer support screenings and assessments, including those in jail, which my understanding is those are not billable at this time, but will be in the future. And they'll be doing peer support services 24/7 across all areas of the county. They also run the only harm reduction syringe service program in that county that runs in multiple locations. So, the expenses for their harm reduction seemed very reasonable. But their peer support really has to do with how they're using peers along the continuum, and they're billing, as far as I could tell, they are billing where they can, but they are going to do a 24/7. And in my experience, it takes 5 people to do that if you don't want people burning out, because you have to have someone out on vacation or out sick and someone else who can rotate on and off, because you're handing off a phone. So you need at least 4 to 5 people, which is what I saw in their application.
Thank you.
I was also a reviewer of Columbia County Mental Health.
Great.
And they're also adding a supervisor and benefits and mileage for their peer support specialists.
Okay.
Which is expensive, as we all know.
And how many do they have? Did it say?
I believe 5.
Yeah,
They'll have at least.
I'm seeing here that they burn funding covers the cost for 3 full-time peer support specialists and a peer supervisor in our outpatient treatment program, as well as 2 full-time peers and a half of a FTE for peer supervisor.
And this is over 4 years, right?
Yeah, this is just in their project scope.
So I'm counting 6, 5 peers and a supervisor.
Yeah,
Am I
3,
correct?
4, 5, 6, maybe 6.5.
But a couple of them was in the outpatient, you said, in the outpatient services?
Yeah, so let me just read this and you guys can interpret it how you want. Burn funds provided for a significant expansion of peer-delivered services at our agency, which is broken out into 2 teams. This represents the largest part of our budget and is reflected by a significant increase in services and capacity. Prior to burn funding, our organization had limited capacity for peer-delivered services as part of our assessment and treatment program. Burn funding covers the cost for 3 full-time peer support specialists and a peer supervisor in our outpatient treatment program, as well as 2 full-time peers and half of an FTE for a peer supervisor in our community-based outreach and harm reduction program, which is called Team How. Overall, burn funds are used to cover 5 full-time peer support specialists and a 1.5 peer supervisor position. In our outpatient treatment program, these positions provide services at a peer drop-in center, the Jennifer Warren Center, 5 days a week. Services offered include individual peer support, peer-delivered treatment groups, wellness groups, harm reduction, and supported employment services. We have partnered with WorkSource Oregon of Columbia County to provide employment-related resources and support on site. Our peer support specialists assist with transportation, including frequent assistance in access, detox, and other services not available in the county. It does go on. There's more bullet points.
I'm wondering, just a couple of things, questions. One, Kathy, the numbers that are underneath the entities' names, can you explain what those are to the review panel?
Those are based on, if we go back a few slides, Carly, you'll see that there's prioritization that they use. Jason, I believe, is the one that helped put those numbers in. He would probably have a better answer than me, but there is a rating. If you go back a couple of, right here, the priority ones on there.
Yeah, that one. Yep.
Yes. So to narrow down the recommendations, we looked at, you know, to make sure that there was a provider in each service area. They prioritized applicants who fully answered questions 7, 8, and the fiscal question 1. And they did emphasis on housing because that is, that's where we've been directed. And we look at those that can bill Medicaid. And so they were given a priority 1, 2, or 3. I'm not sure about the actual numbers. I think that's based on the scores that came through from the review.
Yeah, that's the sum of the scores from question 7, 8, and fiscal question 1.
That's right. Okay, so if we go back, and as a reflection, I believe it's question 8 that also, sorry, Carly, to the full, thank you. Oh, yep. To the full, looking at question 8, it had being trauma-informed, culturally specific, right? It was that list that was in question 8. Is that correct?
Yes.
Okay, so when you're looking at the numbers underneath the entities, you can see that Iron Tribe, Columbia Community Mental Health scored the highest, followed by Medicine Wheel Recovery and Boulder Care and Back to Basics scoring the lowest. And I'm wondering if that helps the review panel make a recommendation that would potentially bring what we put forward to the council closer to the allotment. Zeb?
Yeah, I'll say this. I mean, Medicine Wheel Recovery Services is the only culturally specific certified through OHA Behavioral Health Divisions on there, and they scored lower than 2 other organizations. Number 7 is directly related to culturally specific and linguistically specific services. And so I'm just kind of curious of how they scored higher.
It came strictly from the reviewer's score numbers.
And can someone read question 8 for us so everyone remembers what else is being weighted, and fiscal question 1, which is around the supplanting, I believe, but question 8.
A list of your experience providing any of the following: trauma-informed services, culturally and linguistically specific services, culturally and linguistically responsive services, services to individuals with intellectual and developmental disabilities, services to individuals with physical disabilities, gender affirming and responsive care, LGBTQIA2S plus affirming and inclusive services, youth-friendly and inclusive services, services for parent or non-traditional parent with minor children and or pregnant persons. That's number 8.
Thank you. Keisha?
Yeah, I was a little curious on how Columbia County Mental Health scored high, but one of the priority questions is unable to bill Medicaid, not able to bill Medicaid.
I just want to be clear. So the scores that these are based on is how completely the applicant answered the question, not necessarily how, like, whether they're able. So that is a different prioritization. That was in number 1. It was in number 2 in that box of the prioritizations. It was just how well they answered the questions, and that's what the scores we're seeing. So it isn't necessarily a measure of like how culturally competent they are or whether they can bill Medicaid or not, just how well they answered those questions.
So coming directly off the reviewers' scores.
Exactly.
Yep.
The reviewers scored 0 through 2 on how well they answered the question, and that's the sum of those scores. That's all that is there.
Thank you. Keisha, did that, and Zeb, did that help clarify at least what the numbers are?
Well, I'll say this. I mean, those numbers right there, as the gentleman just stated, how they come to that, like, I don't feel confident that those represent the values that we're looking for exactly in terms of it's how you answer the question, not necessarily how you provide, like, what services, who provides the most comprehensive, culturally, appropriate services. It's like how you can answer the question the best.
Yeah, I think Seb, that is the tension point of the rubric that I think we worked with. Juliana?
I scored Iron Tribe. They're one of those high scorers. They also have a high, for just having applied to one service area, they have a high sticker price there. I don't know if it'd be helpful to describe why I approved their application, but they do provide culturally and linguistic specific services to Spanish speaking communities. They have bilingual and bicultural staff, and all of their materials are in both Spanish and English. They answered question 8 very thoroughly. They provide for all of these areas. And in their budget, the part of why their ask is so high is that they are like, I think a full half, about $1 million of what they're asking for is in rental assistance. And then the rest of it is going to substance use disorder supportive transitional housing. So it's not just paying for the housing itself. They employ a lot of staff that are providing, let's see how they wrote it, substance use disorder treatment on the premises. And I do think, housing is so costly, and housing is also very tied to maintaining sobriety and getting better. So despite there being such a high price for just the one service area, I felt that in their budget they did justify it well, and that it sounds like many of their staff are bilingual and all of their services are in both English and in Spanish. Also went pretty far for me.
Thank you. Jude? If you're talking, Jude, you're on mute.
Sorry about that. I was double muted. I think also one thing to understand is when you're looking at the scores, you're looking at how they answered that question. And question number 8 had multiple components to it, as well as you're not answering them, comparing them to the other applicants, because the scoring is done independently. So for example, I saw Columbia Community Mental Health, but I didn't see Iron Tribe or Medicine Wheel in that same county. So it's hard to compare them. I almost feel like this group should compare answers versus thinking that the reviewers did, because the reviewer might not have seen any of the other applicants in that county. So just pointing that out. And then I did want to say, I'm remembering Columbia County had very strong answers for multiple components of question number 8, including, I believe, American Sign Language and bilingual English Spanish, as well as other languages that were spoken by community members in their county as based in their needs assessment. But I think someone could read these answers if we wanted to compare them to each other.
Thank you. Sarah?
Yeah, I also reviewed Iron Tribe and just wanted to underscore what Juliana was talking about. A couple other pieces. This is related to, I think this came up earlier, but they do operate mini homes, it looks like already, but this is specific to one in St. Helens that's already in operation. So this is to continue a service that's already in place. I just wanted to flag that too.
Thank you. I think also for the review panel, as we're looking at potentially recommending a burn, right, in terms of what would comprise the burn in Columbia County, 2 things I want to say. We have, 1, 2, 3, 4 applicants offering peer support, 3 offering SUD services, and 2 with assessment, 2 with screening. And one of those is culturally specific, comprehensively. And I'm wondering and appreciating that we're at time, so I don't want to rush this, and we can pick it up tomorrow. But just thinking through, if we were designing a burn to put forward to the council, what would that look like in terms of peer support and maybe even such services? And then also just want the review panel to know that the OAC would obviously see this full, the council would understand, not just council members here, but the full council, what was put forward and what was not. So it would not be the final decision either. So I want to put that out there for any thoughts or questions before we break until tomorrow. All right, well, thank you. 2 forward, and it's really challenging work. It's there's a lot of need, a lot of ask, and not as much funding, and maybe not as much detail as we would want in this.
Oh my God! Hey, fuck!
And I hope Melinda's okay. Okay. On that note, thank you, everyone, and we'll see you tomorrow. Bye.
Thank you.